Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
In your dissection of the facial muscles, make sure that you are careful along the posterior margins of the muscles, because through the parotid gland that lies on the side of the face will pass individual nerve filaments going to the facial muscles. These are the branches of the facial nerve. They all have names as indicated in the dissection guide. These should be followed out individually. Those branches that come out of the front of the parotid gland and passing forward into most of the facial muscles of the cheek area are the buccal branches. Buccal branches might be 2 or 3 in number. They might be up to 6 in number. They might come from a common stem and then divide after that into the various muscles, but these are the buccal branches. Another branch that you should see is one that comes out from the lower portion of the parotid gland and passes downward into platysma muscle. This is the cervical branch of the facial nerve. And sometimes in common with it, there will be another branch that swings out to go along the lower part of the mandible and eventually into the muscles of the lower lip. This is called the mandibular branching, sometimes referred to in the Texan atlases as the marginal mandibular. Very important, because here you see the facial artery crossing the lower jaw in association with it. Very important landmark here. So again, the cervical branch and the mandibular branch from the lower portion of the parotid gland. As we move up again in review, buccal branches coming out of the parotid gland. And then above the parotid gland, there are 2 branches that will be passing out. One tends to have a fairly vertical course in front of the ear opening, approximately 1 inch or so. This is the temporal branch, going to supply the frontalis muscle of the forehead. And then one that is more angulated in its course, and for purposes of this dissection, I have not completely dissected it free. And this will be passing over to the corner of the eye to supply orbicularis oculi muscle. It is the zygomatic branch. So temporal branch, zygomatic branch. Lower down then from the front of the parotid gland, the various buccal branches. And these buccal branches will be in association with this anterior structure of the parotid gland. This is the parotid duct. And then, of course, down below, once again, we can see them here, the cervical and the mandibular branches of the facial nerve. Now, I'm going to remove this specimen and show you another one. In this specimen, we have the sternocleidomastoid muscle posteriorly, the lower margin of the jaw and chin anteriorly and to the right. On this specimen, the parotid gland has been completely removed. And now we could see these individual branches that we've been talking about. The parotid gland, after it's been removed, shows clearly here the facial nerve as it's entering the space where this parotid gland was. This is called the parotid fossa. And as soon as it comes out of this area, it divides into 2 divisions. A cervical mandibular division going below, and a zygomatical temporal division passing above. These are the different divisions that give off the nerves by their respective names. Above here, again, the temporal branches, and over here, the zygomatic branch, both coming from this zygomatical temporal division of the facial nerve. In addition, a nerve comes off and joins one from the lower division, and this is a loop formed within the parotid gland, a loop that then continues forward, and in this specimen as one buccal nerve. Going down lower now, we follow this mandibular cervical division, and we see branches coming off. This cut one was to the platysma muscle, and this one yet attached is going to the muscles of the lower jaw. Below the lip, these are the branchings of the mandibular nerve. And also from it is another buccal branch. And so we can see these in detail, and in order to see these kinds of details, you must completely dissect away slowly, picking the components of the parotid gland out and following the nerves back through the gland to completely remove it so that these structures can be seen. Two very important structures that we will be talking about time and time again, and these are the posterior digastric muscle, and in front of it, the stylohyoid muscle. And these muscles receive their innervation also from the facial nerve as it immediately comes out of the area of the base of the skull and swings nerve branches down and into them. Continue this dissection then, slowly and meticulously, cleaning up some of the facial muscles as you go along, if that has not already been done so. In addition, as you're following the fascia upward, recall we dissected that enclosure of sternocleidomastoid muscles, the investing layer of cervical fascia, and that fascia comes up as a sheet, completely surrounding the neck and attaches along the base of the mandible. Once it attaches there, it then continues to cover not only the parotid gland, but also a deep extension that passes downward onto the surface of the masseter muscle. And here we could see some of this dense fascia that has not yet been removed. And then eventually, the fascia will pass upward to attach here to the zygomatic arch. This fascia that surrounds the masseter muscle and the parotid gland is a single sheet of fascia that has several lamina, and this is called the parotidiomasseteric fascia. It confines the parotid gland and invests the masseter muscle as well. Moving upward and rearward from our area of dissection, we have the external ear and the external ear opening. Now notice when I palpate the area that the facial nerve is coming through up in this region, with probe, or better yet with the finger, one can readily notice that this parotid fossa, filled with the deep extension of the parotid gland, is abutting against the cartilaginous portion of this outer ear opening. And this is why, when this gland swells due to the childhood disease known as mumps, there is earache associated with it. Because as you dissect your parotid gland, you will see that this fascial envelope around it is tightly adherent to the structure of the gland itself. And when the gland stretches, it stretches that connective tissue material, and also as it swells, it will be pressing on the cartilaginous portion of the external ear, which will cause the pain associated with an earache, although it is truly not an ear problem. Continue then the dissection, following these branches out. And now let's take a a look at another specimen. Here now the parotid gland is still in place. Very tight. And look at this parotidiomasseteric fascia tightly binding the gland down in place. The parotid duct passing forward and around the front border of the masseter muscle. An accessory parotid gland here, little extension of tissue of the parotid gland following along the duct. Adjacent to it, buccal branches of the facial nerve, going into the posterior aspects of the facial muscles. As you're working in this area, you will see again the external ear opening, and running upward in front of that region, you can find an artery and vein, the superficial temporal artery and vein. Prepare for it, because as you're dissecting away the parotid gland to get deep within to see the facial nerve, I don't want you to accidentally remove the superficial temporal artery and vein. Again, as we look at the parotid gland, it extends from the low down the base of the mandible by the angle of the mandible and up to the zygomatic arch. It's wider above than it is below, and it looks like a flat glandular structure, but as we saw once this is removed, there is a depression in here called the parotid fossa.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.